bunch of people talking. It's not just about, you know, seeing this beautiful red, white, and blue go across the state. It's about taking action.
And I think that this beautiful bus, is a great reminder and a great wake-up call for us to see how family planning and how women's health services are really important. So because an unplanned pregnancy is something that affects not just the women, but also affects men, it affects children, it affects all of us. So this is why it's incredibly important for us to all get involved, be aware, and especially with young people, because as young people, we need to have a voice, we need to stand up, and we need to participate. And women, you know, this is not some far off issue. This is our daily lives. This is our health. And men, this is not just a women's issue. You're equally affected. If your partner is on birth control, you're receiving the benefits of not having to deal with an unplanned pregnancy. So obviously, this is an issue for both men and women, young and old, everyone.
I stand here perplexed. You know, is it the year 2012 or is it the year 1912? We are battling the very battles, unprecedented numbers of battles about birth control and women access to women's reproductive health care that are eerily similar to the very same battles that Margaret Sanger fought back in 1912 to the mid-1960s. What we're looking at is if you are poor, marginalized, or uninsured woman in the state of Texas, you may be denied that access. And I find this ruling denying hundreds of thousands of women access to women's health care, vital medical care. It is arrogant, it is elitist, it is sexist, it is oppressive, and it is shameful. We're at the top of the list. We're number 4 in the country for teenage pregnancy in the nation. We're number 1 for repeat teen pregnancies. And we are number 3 for cervical cancer rates in the United States. And this women's health program would prevent all of that. And Perry and the government talking about saving money is not the reason, because all preventive care saves money. So it is about taking away the rights of women in the state of Texas. So this is just one small step for the government, state of Texas, and the governor to take away women's reproductive rights. And we can't allow that to happen. So use whatever resource you have. Maybe it's some allies, maybe it's Facebook, maybe it's voting. It's your voice. So do not let the governor of Texas and the state Texas government keep you complacent and silent. Have a voice.
Central Texas, the time is now.
Yeah.
Women of Texas are being used as a political chess game where politicians are using women's health care as a pawn to try to eliminate women's reproductive health care. It's time to speak up and speak loud and clear. Women of Texas deserve preventative health care, including birth control, life-saving cancer screenings. Without the women's health care program, low-income women, who are generally the backbone of our families, will have to make very difficult choices. They will have to decide whether or not they pay for food or pay for their own health care to prevent another pregnancy from occurring. Do not be deceived. Our state is using women to try to force legalized discrimination. Women's health care is slowly being whittled away, and now it's just a few short days from being non-existent. This is the only program that we have left that can help low-income women get health care. In the process, this San Marcos and our own local clinics here, we have been forced to close clinics due to decreased funding. Why am I upset? I have a daughter and a granddaughter here. We've been part of this community forever. Very proud of what we've done in this community, but I'm very disheartened with what the state of Texas has done. I am upset because our agency, Community Action of Central Texas, has had to close seven of our rural health clinics in the past 5 years. We're down to 2 clinics, people, one in San Marcos and one in Lockhart. It's a disgrace. Our money keeps getting taken farther and farther, and we keep having to stretch it farther and farther, and it's time to say stop. funding goes away, over 1,100 local women and men will suffer the consequences. I am outraged. Are you outraged?
Yes!
That a few legislators can make the decision for women as to whether or not they can have access to affordable health care, including birth control. It really makes me mad. The time to act is now. We can't wait. Tell your elected officials that by eliminating women's health care program, they are closing the last safety net for women's health care. Without this program, the likely outcome will be an increase in unplanned Medicaid paid births, an increase in undetected cancers, and an increase in higher rates of sexually transmitted infections. Tell your Texas legislators that now is not the time to decrease women's health care. Now is the time to make sure that every woman who wants reproductive health care can and will have a health care provider that is accessible and affordable.